Good afternoon. My name is Erica Lee, and I am the director of the Immigration History Research Center here at the University of Minnesota. I'm so glad that you've joined us this afternoon for our special webinar on immigrant legal status among essential frontline workers in the US during the COVID-19 pandemic era. Before we begin, I'd like to start with a land acknowledgement. The University of Minnesota Twin Cities is located on Dakota land, and today many Indigenous people, including the Dakota and the Ojibwe from throughout the state, continue to call the Twin Cities home. The IHRC acknowledges that the migration of immigrants and refugees to the United States has been part of the same US settler colonial practices that continue to displace and dispossess Indigenous peoples. We believe that the study of immigration should and must acknowledge these intersections, these consequences, and legacies. This land acknowledgement is one of the ways in which the IHRC works to educate the campus and our larger community about this land and our relationships with it and each other. We are committed to ongoing efforts to recognize, to support, and advocate for American Indian nations and peoples. I also wanted to start with a few housekeeping items that are important to keep in mind during the webinar. First, we are being recorded. Second, the question and answer portion of our event will happen at the end of the presentations, and it will happen via the Q&A function. You don't have to wait for the end of the event to pose your question. You can submit one at any time during the entire event. You can choose to submit a question under your own name or also anonymously if you do not want your name to be mentioned when the question is posted. And now I'm very pleased to introduce our speakers for today. First is Professor Ryan Allen, who is a housing and community development scholar with a focus on the experience of immigrant communities in the United States. He's currently a faculty member in the Urban and Regional Planning Program at the Humphrey School of Public Affairs at the University of Minnesota. Allen's research focuses on urban planning, housing affordability, public housing, and immigrant integration. He holds a BA in economics from the College of William & Mary and an MCP and PhD in urban planning from the Massachusetts Institute of Technology. Next is Jose Pacas, currently the Chief of Data Science and Research at Kids First Chicago. Previously, he held positions as a research scientist at the Institute for Social Research and Data Innovation at the University of Minnesota, and as an economist in the Poverty Statistics Branch of the US Census Bureau. He currently serves as a member of the National Academy of Sciences panel on evaluation and improvements to the Supplemental Poverty Measure. Jose holds a PhD in applied economics and a Master of Public Policy degree from the University of Minnesota and a BA from Williams College. And our last presenter is Zoe Martins, who is a second-year Masters of Human Rights student with a focus on migration at the Humphrey School of Public Affairs. She holds a BA in Comparative American Studies from Oberlin College and has previously worked as a domestic violence advocate for immigrant survivors in Minnesota and a legal advocate for Central American asylum seekers in Tabasco, Mexico. Her recent project with El Instituto para las Mujeres en la Migración measured the implementation of Mexico's federal legal reforms prohibiting the immigration detention of children and adolescents. Welcome all. I believe Ryan is starting us off. Thank you so much for joining us and for sharing your research.
Thanks for the kind introduction, Erica, and thanks everyone who's in attendance for coming. Like Erica said, my name is Ryan Allen, and I'll be starting us off with a shared presentation that Jose will be controlling. Thank you, Jose. So as you can see from the title of our presentation, we are focused on the issue of immigrant legal status and how immigrant legal status is represented among frontline workers during the COVID-19 pandemic. We first became interested in this over a year ago. Like many people, we were noticing popular press articles on this topic and wanted to do something more rigorous. So let me get into a little bit of the motivation here. These are a table and a couple of charts that come from a piece that was recently published by Kim Horner, who is also at the University of Minnesota, along with a couple of co-authors. And the focus is on mortality rates, and in particular, the difference between immigrant and non-immigrant mortality rates in the state of Minnesota due to COVID. So I'm not going to get into a lot of the specifics here, but I'd want to draw your attention to the upper left, which I've circled in red. After controlling for gender as well as age, their research assesses that the mortality rate for foreign-born residents of Minnesota due to COVID is double that of the US-born population in the state. If you direct your attention to the charts below, this is particularly pronounced, the disparity in mortality rates is particularly pronounced among working age adults, those, let's say, between the ages of 40 and 65 or 70. You see a marked disparity in each of those charts. So when you put all these things together, you get some real concerning preliminary data. This has been buttressed by the popular press, as I was mentioning earlier, and I want to start with the headline on the upper left, coming from April of 2020. So very early on, we're identifying during the work stoppage that was precipitated by the pandemic that there are some essential workers out there. And this article is pointing out, somewhat ironically, that undocumented, unauthorized immigrants who are constantly in danger of being deported and are not legally allowed to work in the United States, all of a sudden became essential workers during the pandemic. If you progress to July, the second headline article is recognizing the risk that these frontline workers experience, right? How do you get your berries? Migrant workers toil while fearing the virus. And continuing the arc, the final headline I'm presenting here is about the real danger, the real outcomes related to mortality. And here we're highlighting the meatpacking plants and the outbreaks of the virus there and eventual deaths of workers that were there. So this arc, this storyline between being an essential worker, facing the risk, and then the potential to die from exposure to COVID-19 because of your job is one that we really wanted to dive into with this research. So here's our hypothesized causal link. Let me be clear that we're not going to make a causal argument, but we want to build a hypothesis about how this link between immigration status and frontline worker may help to explain the disparities in mortality rates that I was just commenting on earlier, right? So the link starts with immigrants, and particularly unauthorized immigrants, being overrepresented among essential frontline workers during this pandemic, right? These workers, particularly, again, the immigrants and unauthorized workers, tend to be situated in lower paying, low prestige jobs where having any agency over the context in which you work and mitigating risks is difficult, right? And together, this results in the potential for high risk of exposure to COVID-19 in the workplace. After exposure, there are a variety of social and economic circumstances that immigrant essential frontline workers face that make it difficult for them to treat their illness and perhaps also prevent the spread of virus to others. Right. So this is the hypothesized causal link that we believe may be operating to help explain these disparities in mortality rates that I presented just as I opened the presentation. Before we're going to get into some of the data, and Jose is going to take the lead there in this presentation, I do want to introduce a couple of pieces of theory here that help us understand not only how we might structure the analysis, but how we might interpret as well the analysis, right? And so I'm going to start with segmented labor market theory. A group of labor economists hypothesized that in developed industrial economies, there's not one labor market, there are actually two, right? And the first they call the primary sector. This is a sector known to many of us in academia as is characterized by really knowledge-intensive work. It tends to be remunerated very well with high wages, elevated social status, and very stable employment, right? So think about high-achieving, highly educated, highly skilled workers and the kinds of wages they earn and the kinds of employment contexts in which they work. Contrast that with the secondary sector, right? This is a labor market that's marked by manual labor or more labor-intensive types of jobs. It tends to be lower skill or low skill, and in tandem, lower wages. Together, these things that these labor economists hypothesize confers lower social status and kinds of jobs that are marked by unstable employment. I want to point out a couple of more factors here that are relevant for our discussion today. One is there tends to be, and this has now been borne out empirically, very limited mobility between these sectors. If you start in the secondary sector, it becomes very difficult to transition to the primary sector as an adult worker. It's also true that you can see both of these sectors at play in the same institutions. So for example, hospitals where you can find highly trained, very well paid physicians, as well as janitorial staff and food service workers that in contrast are very poorly paid and have much less stable employment. Finally, I want to end on this slide and thinking about where foreign-born workers fit here. And here again, research tells us that foreign-born workers and especially unauthorized immigrants disproportionately work in the secondary sector. This secondary sector has some inherent and I think it's accurate to say structural risks that are associated with the employees who work there. And I want to call our attention to immigrants that are in the secondary sector now, right? Again, to reiterate, the secondary sector tends to be physically demanding. It tends to be labor intensive. It also tends to be dangerous. And it tends to be marked by a lack of agency to control working conditions and mitigate risks, right? So we see this borne out in data on injury rates and fatality rates for immigrants relative to native-born. Immigrant workers tend to suffer much higher injury and fatality rates at the job. It also, I think, is incumbent upon us to recognize that immigrants may lack the kinds of occupational safety and health training that other workers may have, even in the secondary sector, because of not only their contingent work nature, but also the fact that they may be less conversant or fluent in English, and therefore less able to understand some of the directions around safety that may be present in a workplace. It's also not lost on us, as is true for many researchers who engage in this work, that there may be a failure to report injuries and an actual fear of reporting injuries because of a hesitancy to interact with authorities and the threat of job loss that immigrants, and particularly unauthorized immigrants, may carry with them. I want to introduce a second set of theory that I think, again, will inform our research that we're presenting today. And this is coming from this public health, the social determinants of health in particular, and how social determinants of health represent a set of risks for immigrants. If you're unfamiliar with this body of research, it's the essential idea that different kinds of identities, and in our case, in particular, race, immigration status, and socioeconomic status, help shape the ability to access resources and also help to shape the exposure to health risks. That could be in the workplace or in living conditions. And again, we want to call attention specifically to immigrants within this literature, right? So immigrants, as many of you are undoubtedly aware, are structurally and purposefully excluded from many health protective resources. For example, access to insurance provided by the government for people of low income. It's also true that immigrants face a tremendous amount of stress related to deportation and threat of deportation for those who are unauthorized, and other kinds of stresses related to being an immigrant in the United States. The concepts and the identities of race and immigration status are not siloed from one another. In fact, they work in tandem, right? They work in tandem to help shape these health outcomes. And you can see this interactive effect in how individuals experience their health status here in the US. I also want to call attention on the bottom part of this slide to some real specific factors that immigrants face in their everyday lives that may compound the risk of COVID-19, and we put under the heading of social determinants of health. And the three that I want to call our attention to are the disproportionate reliance on transit and therefore interaction with lots of other people in close proximity that immigrants experience relative to native-born. Immigrants are also much more likely to live in overcrowded housing than native-born residents, and therefore may be less able to segregate themselves or to quarantine if they do become ill. And finally, it's also very well understood that immigrants tend to be have lower rates of health insurance than native-born, and that, of course, can play a disastrous role in recovering from illness or even preventing illness in the context of the U.S. So, for our research, there are three essential questions that we want to investigate, and we're going to present some results on. All of these questions are in service to understanding whether essential worker status is a plausible explanation for the disparities between immigrant and native-born residents in COVID-19 mortality rates. The three questions are listed here. The first is, what is the distribution? Do we see an overrepresentation of foreign-born workers, and in particular, unauthorized immigrants labeled as essential workers in the US workforce during the pandemic? The second question is, how likely is it that essential workers are able to control their working conditions? And we're going to respond to that question with a proxy measure for primary versus secondary labor market status. And the third question that we'll tackle in this research are, do essential workers have characteristics of the social and economic nature that make them less likely to be able to mitigate their ability to manage risk of COVID-19, or are they able, or is it in fact aggravating factors that make it more likely that it'll be difficult for them to not get sick, and if they do get sick, to recover? So let me give you the really high-level finding from our research, and then I'll turn it over to Jose to go into more depth. Of course, I think many of us are aware that that there are a variety of nativity statuses and immigrant legal statuses in our workforce today. What you see on this chart is are the estimates of the number of workers overall in the U.S. labor market, 175 million, and how that breaks down by nativity: 145 million native-born workers and 30 million foreign-born workers. If we look specifically at that foreign-born number, the 30 million, we see, again, this is based on Census Bureau data, that about half of that number are naturalized immigrants, and the remainder are equally split between authorized immigrants and those who are here without legal authorization. So if that's the labor force, let's look specifically, and this is going to be our punchline. What does the distribution of essential frontline worker status look like across nativity? Overall, if you look over at the entire workforce, our estimates are that about half of workers were considered essential frontline workers, meaning that during the pandemic, they were designated essential by the US government in their directives, and also it was really unlikely that they could work from home. They had to be in the workplace. The native-born is really comparable to that overall proportion, but if we look at the foreign-born, there's a disparity there. It's a higher rate among the foreign-born, but that higher rate is not due to naturalized immigrants or even authorized immigrants, who tend to look a lot like native-born in terms of their probability of being essential frontline workers. In contrast, unauthorized immigrants, at 70% of unauthorized immigrants in the workforce, are considered essential frontline workers. So this gets to the contribution that I want to spell out right up front, and then we'll develop this over time in the remainder of the presentation. This essential frontline worker status, when you look at it across nativity and immigrant legal status, and when you take it into consideration the occupational standing of those workers, you're going to see in our research that there's a lot of risk that in particular unauthorized immigrants are experiencing here. So we're going to be drawing on this segmented labor market theory to account for sorting into the primary and secondary labor markets. And when we do that, you're going to see an even wider gap that emerges in our estimates. And finally, we're going to pivot to looking at the social determinants of health, that is the characteristics of these essential frontline workers, and demonstrate that their home lives and the kind of characteristics that define their households as well as their place outside of work is really going to compound some of the risks that they experience in the workplace. So I'll turn it over to Jose now. Take it away, Jose.
Good afternoon, everyone. My name is Jose Bacchus, and thank you, Ryan, for introducing, and thank you to everyone for having us and everyone that's joining. I have the pleasure of introducing the data and methods, which is always exciting, but up front, I just want to let people know that the work that we're doing and a lot of the data work that we're doing is actually, there's no real complicated methodology. However, we are doing a lot of work to gather the right set of data in order to get to this unauthorized essential frontline worker rate. So how do we do that? We start with the American Community Survey. This is a nationwide survey of about 3 million people, which is about 1% of the US population. And if you have no familiarity with the American Community Survey, just know that it is required by law. So if you were to get this in the mail and you don't want to answer it, well, they're going to keep on coming back to ask you for the response. And this is actually like Article 1, Section 2 in the Constitution. We talk about census enumeration. And we collect all this data, and it's separate from the census, which is every 10 years. This is every year. So we use data from 2019. And what ends up happening with these data is that the Census Bureau collects, and then it disseminates the data, and all of this is used by federal, state, and local agencies, emergency planners, businesses, journalists, educators, and researchers like ourselves. So we take that data and we do a lot of stuff to it. So here's what happens. To understand the ACS, you need to understand that they ask questions about the particular population, people level data. They come into the house, and I'll show you an example of what the data look like. But they come in and they ask age, citizenship, educational attainment, employment status, health insurance coverage, income, industry, occupation, class of worker, race, ethnicity, sex. The list goes on and on. But what I want you to highlight or remember is that we have all the data we need to really get down to the numbers that we are interested in. They also ask a lot of questions about housing, and I'll present some results looking at some of the housing level data. Importantly, these data are available publicly. There's no personal identifiers. Everything's kept very private. And we collect that. We actually have something in-house at the University of Minnesota. One of the greatest resources in the country, if not the world, is IPMS, which makes it easily accessible. So if you're interested in data from the Census Bureau, take a look at IPMS. So what did the data look like? And here's where you need to start coming in and saying, how did they get the data together in order to get these estimates? And that's all I really want to do is a top level view of how we did this. So this is just one family in the data. When we open up the data set, this is a part of what we look like, of what the data look like. And you can see here that we have a family of 6. We have a male, female, they're married, they have children, 7, 6, and it looks like they have twins. But importantly, you can see that they have the occupation and the industry of their job. That's going to be a key thing for us. And you can see that the occupation for both, they both work in computer system analysts and computer scientists. That's their main occupation, but they differ in industries, right? It seems like one of these people is working at an elementary school, and someone else, the first person might be working at some sort of private company. So with these data, we are able to do a lot. And here's how we augment the ACS, the American Community Survey data. First, we add data on physical proximity, which we get from a source called ONET. And what it does is it gives us a response range from 0 to 100, where 0 means that you're working over 100 feet away from other people, and 100 means you are literally touching other people. So that gives us an idea, and we'll drill down into this in our results, is is this person physically touching the other person? How close are they to other people? Which gets to, can they mitigate the risk of contracting COVID and spreading COVID in the workplace? So what we use is we get data for every single occupation code that we have in the American Community Survey, and we link that up with the ONET data on physical proximity. Probably the most complicated part of the entire process is implementing and identifying likely unauthorized immigrants. And there's a lot of literature out there. There's a lot of different methodologies for that. But the methodology we end up using is the logical edit method out of the Center for Migration Studies of New York. This is developed by Bob Warren in 2014. And in essence, to understand just a little bit of what happens, the logic is that we know from research that unauthorized immigrants do respond to surveys, in particular the American Community Survey. And we know that we can take a lot of the variables that are included in the data. For example, if they're married to a US citizen, are they working in certain industries or occupations that we know are likely to be, very unlikely to be held by someone without, that is unauthorized? Do they receive public benefits, et cetera, et cetera. So it's a whole laundry list of things. And we basically do this methodology to weed out people who are likely authorized. And the research shows that when you do that, and you couple that up with various other population controls and underreporting controls, you can get a very reliable estimate of the likely unauthorized immigrants, and most importantly, about their demographics and occupations, which is what we need to do our work. So we implement this method into our data, and that's probably one of the biggest things that we do. Next, we also add a measure of occupational standing, which is based on educational attainment. And this is going to be how we approach the segmented labor markets, primary and secondary. What we're saying is you line up all the occupations of workers, you take within every occupation the percent within that occupation who have completed at least 1 year of college. And so basing this methodology of other papers, we can see that the highest ranking groups are likely to be in the primary market, and the lowest ranking groups are likely to be in the lowest ranking in the secondary market. So we use that data based on occupation, and we get our distribution of occupational standing, which is going to be our proxy for the primary and secondary labor markets. The key component to all the work that we're doing is identifying essential frontline workers. We already have the unauthorized flags, and the next thing we have to do is add in the essential workers. So the Department of Homeland Security, Cybersecurity, and Infrastructure Security Agency, much easier to say the acronym, they give guidance on essential industries. They give a full list of industries, which matches up to the codes that we have in the ACS. And they tell us these are the industries that we consider to be essential. So we take that, and if you remember back to the pandemic, there's industries that were considered essential, but were shut down. So we take a look and we do a lot of sensitivity analysis as to how sensitive are results to these definitions of essential. And ultimately, we take guidance based on the December 2020. And one of the key things here is that it includes the education sector as an essential industry. So we get these guidelines and we match them up to industry, which I showed you in the data we have, and we can identify who is essential. The next step that we're looking at is frontline. We're saying who cannot work from home. They're essential, but they cannot work from home, and therefore it means they have to be out in the field. For that, we use, again, the ONET survey, which gives us the ability to classify people based on their remote work feasibility. And so we take that, we get that at the occupation level, and we map that onto the ACS data. So what does that look like, and what have people done in the past? And this is getting to the contribution as well as to what we're doing. There are 3 papers in particular that have tried to analyze these groups, but no paper has combined everything together. We are that first group to do that. And just for some idea, we have essential worker status, where Kearney and Pardue found that 53% of workers are essential, which is very close to the 50% we find. Then when we jump into the essential frontline workers, they find that 34% of workers are essential frontline, but this excludes the shutdown industry, which is not what we look at. And finally, we have the essential worker status among immigrants, which is Bob Warren and Kerwin out of the Center for Migration Studies of New York, where they are the first to look at the unauthorized aspect, where they find that 74% of unauthorized immigrants were essential workers as opposed to 65% of native born. But if you notice, none of these take the essential frontline workers and the unauthorized immigrant aspect to that. So we are the first to do that. So what are the main findings, right? We come back to this. That 70% that you see to the right, that number is a key number that we are the first to be able to produce and to look at from the essential frontline workers. That is a disproportionality that we want to highlight. And the next question as we delved into it was saying, well, 70% of workers are there, so what is driving that disproportionality? The first cut, and these are just a list of selected industries, but you can see that the unauthorized workers were primarily in the construction industry, as well as the arts, entertainment, and recreation, and accommodation and food services. And this is in stark contrast to the native born. The essential frontline workers for native born were primarily in education services and healthcare and social systems. So already we're starting to build up this story that gets to this primary and secondary labor market. So how do we get into those? So we construct, right, go back to the occupational standing scores where every occupation is listed by the percent that have at least 1 year of college completed. We take that, we split that into 4, and we focus the lowest quartile as the lowest occupational standing and the top quartile as the highest occupational standing. And so what you're starting to see here is that it really matters what the primary and secondary labor markets really matter in explaining where the distribution of unauthorized immigrants exists. So if you consider on the right, 55% of unauthorized workers work in the secondary labor market. If we take that lowest quartile, or even if you take into the second quartile, we can see that 90% of unauthorized immigrants work in the lowest quartiles of occupational standing. And that is in stark contrast to the 40% and 23% of native born that are working in the second and third quartile. And if you just take a look at the native born in the top quartile, the highest occupational standing, that's 15% as opposed to the 2%. And so if you are able to see the colors, I am colorblind, I still struggle seeing this. Apparently all of these are green, but the dark green is where you're noticing the concentration of unauthorized immigrants and the native born. That's what we're looking for, is where is it the highest? Next, we said, let's use the proximity data. Where does that exist? Are unauthorized workers working physically closer to one another? And what you see here is that, in fact, when you take that proximity score, it is not the unauthorized workers who are working in closest proximity to one another. If you look at the bottom row, the darkest green, you can see that the native born is 78, have a score of 78 in that fourth quartile, as opposed to 66 of unauthorized. Or if you look at the score in the lowest quartile for unauthorized, 62, so to the right, right? So this means that, and maybe this lines up with people's preconceived notion that unauthorized workers are in fact not working very closely to one another on average. So that may not be part of the story. And as we started to think about that, we said, well, let's take a look at what the occupations are for these essential frontline workers in that lowest quartile. So this is regardless of foreign-born status. This is just for everyone. You can see that the lowest quartile of occupations consists of janitors, laborers, construction workers, housekeeper maids, butlers, and miscellaneous food prep workers. Already, even if I didn't tell you what group was in here, you would say that is an occupation that is largely dominated by the immigrant workforce. So already this is lining up with things that we might have our understanding of the occupations and the workforce. And if we look at the other end, the top quartile, right, the primary market, labor market, you see that it's dominated by registered nurses, primary school teachers, computer system analysts and computer scientists, computer software developers, accountants, and auditors, right? So already you're thinking, right, that is a completely set of distribution of workers in that group. So this lines up and helps us understand the proximity scores that we're looking, and that may not be the driver of the disparities that we're looking at in terms of COVID proliferation, getting COVID, spreading COVID, preventing COVID. Proximity is not part of that story for unauthorized workers. What is and we look at the social and economic characteristics that help unauthorized workers or workers mitigate contracting and dealing with COVID, we start with health insurance. And this is maybe one of the most stark contrasts that you'll see in this entire presentation, is that 43% of unauthorized workers have health insurance. As in over half do not have health insurance. You compare that all the way to the left to the native born, that top line number is 88% of native born workers have health insurance. Foreign born workers, or if you look at naturalized and authorized, that number is 77% or 88%. This is less than half for unauthorized workers. This is a huge disparity. And if we go down and we say, let's look at that secondary labor market, let's look at that that lowest quartile of occupation, we see that number drops to 35%. And even if we go down to the primary labor market, that top quartile, that 87% down to the right, that is as high as it gets for unauthorized workers. And that's nowhere near, that's closer to that 92% for authorized workers. This is a huge disparity that we've uncovered through this lens of primary and secondary labor markets. Next, we also look at income. We can see if we define the poverty line. So to give you an idea, the poverty line for a family of four with 2 kids is about $25,000 a year. And let's say that sounds like a very low number. Let's bump that up a little bit and let's see what that is if we're somewhere around $35,000. You can see that the poverty rates or the lower income is distributed or is highest for the unauthorized workers. That low quartile, quartile 1, that is 32% live below the 150% of the poverty. And you compare that to 19% for native born. What this is and what you're trying to think about are the economic characteristics, what the money is able to afford these families. You can see that that is lacking for unauthorized. Finally, we started looking at the conditions under which they live, as in the housing characteristics. So we know from the American Community Survey who they live with. And when we look primarily within the household, we can understand and analyze if they're living with other essential frontline workers. And the theory or the thought behind this is saying the likelihood of contracting, but also spreading within the household, but also think about what happens in a married family if it goes from one parent to another, or it means that both parents have to go out and work and be essential frontline workers. Think about all the things that trickles down into in terms of daycare, schooling, et cetera, et cetera. Just think about how hard that would be if both people in the household would have to go out. And then think about what it means once people contract and how that proliferates within the household. So you can see that the highest proportion is for the unauthorized workers. 67% of those living in quartile 1 are living with other essential frontline workers. And you compare that over to 48% for the native born. Now, as it goes down and you get to that higher quartile, as you see it somewhat levels out, but the highest proportion and that disproportionality is for that lowest quartile of unauthorized workers. Finally, if we think about overcrowding, how if I get sick and I need to find a separate bedroom to isolate, how does that play out? And one measure for that is measuring the percent of unauthorized workers or the entire group that live with more than 2 people per bedroom. And that percent, again, is highest for unauthorized workers. We're looking at 24% in that lowest quartile, 22% overall, as opposed to 5% overall for native born workers. So the main takeaway here, you can see how this entire story was, with all this rich data, what can we understand about these essential frontline workers across native born status? But one of the top line results for us is that the majority of unauthorized workers were essential frontline workers and were essential for keeping the US running. That's a top line result that we have. Next, that the work conditions in the segmented labor market, the primary and secondary labor markets, and the characteristics of the essential frontline workers are associated with these poor health outcomes, their inability to cope and deal and avoid the spread of the virus. And finally, and this is even beyond COVID-19, this is focusing in on the inequalities in our society over who is best positioned to protect themselves from contracting the virus and prevent spread. But even if you took the virus out of that equation, it's just saying, are families able to deal with shocks in general? Are they able to cope with any sort of bad situation that they may face? And that's what we're bringing to highlight, and COVID-19 brings a huge spotlight onto that. And so with that, I'll pass it over to Zoe.
Great, thank you, Jose. I'll take us home here and try to leave time for questions at the end. I just wanted to talk about how we can understand these findings and what they might mean for policy. What are the policy implications of these disparities that we have found in our research? So as Jose just said, our findings show that unauthorized workers are very disproportionately represented among essential frontline workers, and also disproportionately work within the secondary labor market, as we found with that proxy measure. So this means that unauthorized essential frontline workers are both essential to the economy and at the same time denied access to these health protective resources, both within the workplace and beyond the workplace. And by health protective resources, I'm getting back to those theories that Ryan teed up for me in the beginning, that, for example, working within the secondary labor market means working in occupations that have lower wages, lower job security, and also lower efficacy to organize in the workplace and to demand increased protections. And this denial of protective resources within the workplace also is reflected beyond the workplace in those social determinants of health that we were talking about, right? So some of those examples that Jose just gave of seeing higher rates of poverty among the unauthorized workers, lower access to health insurance, overcrowded housing, and all of these social characteristics contribute to more negative health outcomes. And so this kind of brings us to the question of how can we understand this paradox of being an essential worker and at the same time being denied access to resources that can protect your health. And so here I wanted to just draw our attention to the creation of these structures, right? The creation of unauthorized status or migrant illegality, as De Genova says. These are not natural conditions, but they're created by the state, by laws, by politics. And so it's important to highlight that as we try to understand this paradox. For example, this concept of migrant illegality, De Genova says that it was created not to completely exclude people who are unauthorized, but rather to include them partially, to include them under conditions of precarity that create this labor force that is more prone to exploitation, as we've seen in this theory of the segmented labor force as well. And this kind of can facilitate an employer preference for workers who have less access to organizing, less access to demand workplace protections. And so the combination of these factors of working in the secondary labor market and then the social conditions that are experienced within and beyond the workplace could help to explain these higher mortality rates for foreign-born workers, as Ryan showed us in the beginning, right? So we can't make a causal argument, but we could see how the causal path could go one of two ways. It could be that there are higher rates of COVID infections from having to work in person in the workplace. And then there are difficulties after treating COVID and preventing the spread due to these social and economic characteristics that are more prominent among unauthorized essential frontline workers. Or it could be the reverse, that the social and economic characteristics make it more likely that workers contract COVID, and then going to work in person, having to go to work in person could facilitate the spread. But what we want to highlight is no matter what the potential causal direction is, this really highlights that these are structural inequalities, and a focus on individual behaviors or family level behaviors around vaccination and quarantine. Though these are important factors in a public health crisis, this individual focus isn't enough because it assumes that all people have equal access to making these choices. But we can imagine that, trying to get vaccinated and navigating a medical care establishment would be a very different experience for someone who was born in the US versus someone who does not have documentation status and likely doesn't have access to health insurance, might have concerns about the implications of providing personal information on paperwork, et cetera. So we can see how making these decisions, people don't have equal access to making these decisions. So we need to look at those structural level issues as well. And this will bring us then to some policy implications. If we recognize the importance of the structural conditions that contribute to these disparities in essential frontline worker status and these disparities in access to health protective resources, we have to consider policy implications. And with the pandemic, we have also seen some potential new avenues for immigration reform in the US come up. As we have seen for the past many decades, immigration reform has been an extremely challenging political arena. But with the pandemic, we have seen that some academics and researchers, as well as elected officials, have been using the pandemic and the evidence of the importance of immigrant workers to argue that these workers are owed a path to citizenship. That is seen, for example, in the proposal for the Citizenship for Essential Workers Act. And we can see that this would have huge impacts. A potential 7.2 million people could benefit from this proposal. But it also brings up a larger question of, should we be using a frame of deservingness to grant citizenship to certain people? Even though this proposal would benefit millions of people, it still pivots on whether people were deemed essential workers, whether they have made a sufficient economic contribution. And it wouldn't necessarily get at the structural issues that produce immigrant workers as those with less access to protective resources, right? Not everyone would have access to citizenship under this program, and there would remain a population of unauthorized people who would form the new secondary labor force. So that's why we think that a pathway to citizenship for all would be the most effective policy response that would most effectively address these structural inequalities that have been highlighted in the pandemic. So one example of this is the proposed US Citizenship Act of 2021, and its main eligibility criteria is that people who have arrived in the US before January 1st of last year would be eligible. And this would benefit over 10 million people potentially. And this larger scale legalization program would be better positioned to address some of these structural issues, especially if it were accompanied by some sort of a rolling registry program, which would mean that it provides for the future legalization, or rather the legalization of future long-term undocumented residents. For example, it could have a rolling date of providing access to legalization for unauthorized residents who have been in the US for 10 years or more. And so this kind of pathway to citizenship for all, accompanied by this rolling registration, would best start to address these inequities, because it would provide for all immigrant workers access to healthcare without fear, for example, increase access to organize in the workplace, and overall would increase the access to these health protective resources that we've seen are so important during the pandemic. And I just wanted to close recognizing that even though federal policy change is extremely important, would be very essential to starting to address these structural inequities, immigrant workers have also been and continue to organize for their rights and protections. And there are worker-led organizing models that will continue to be an essential complement to policy change. So I wanted to highlight some of these efforts in closing this presentation, and recognizing that though it's certainly true that the secondary labor market is characterized by a lower ability to organize, to impact working conditions, it's not to say that immigrant workers are not organizing. And so I wanted to highlight the success of some different worker-driven social responsibility models that have been really prominent in industries where immigrants are disproportionately represented, such as agriculture and dairy farming, and highlight here the work of the Coalition of Imilaki Workers in Florida, as well as in Vermont, the program Milk with Dignity. In both of these programs, workers have been able to lead and create codes of conduct that farmers and growers sign on to. And the code of conduct subjects them to monitoring of a third-party monitoring body where they can really monitor the working conditions, ensure that workers' rights are being respected. And these models have been largely successful and have had really important implications during COVID as well. Have been able to ensure that workers have paid sick days, and the codes of conduct have expanded to include COVID protections and responses. And one exciting thing is that this model is expanding into other industries as well. Here in Minnesota, currently expanding into the construction industry, which we saw in our results is an industry where unauthorized workers are disproportionately working. So we'll be keeping an eye out for the Building Dignity and Respect Standards Council, their work creating a code of conduct and monitoring compliance of developers and construction companies here in the cities. So I will close with this, just wanting to recognize that we must recognize and value immigrant workers not only as essential to our economy, but also as an essential part of a broader movement towards justice for workers and for all people, as seen, for example, in these successful models of immigrant workers monitoring and defending their rights on the front lines. Thank you.
Thank you so much, everybody. I want to remind our attendees to pose a question using the Q&A function, and we can get to those in the minutes remaining. But first, I just wanted to say thank you again to Ryan and Jose and Zoe for this fascinating presentation. I think, like many, we were very familiar, we have been very familiar with all of those headlines that you shared with us, Ryan, about essential workers, that we were generally aware of the disproportionate impact in terms of infection and mortality to essential frontline workers, and assumed that unauthorized status also placed individuals at greater risk due to a host of reasons, but including and especially structural inequality. So the fact that you've been able to quantify this is really phenomenal. I love the questions that are raised, including Jose's final question, which is more broadly asking us to consider what is at stake when this data reveals that our families are at risk before, during, and after a pandemic. And what does that mean for us thinking about fixing some of these problems in the future? And then I really appreciate Zoe's questions about policy, how a quick fix, not, and as it turns out, not so quick and not so easy, of course, given our Congress, but the focus on essential citizenship for essential frontline workers really does raise questions that we've seen in the past about immigration reform, incremental measures that focus on the low-hanging fruit, the easy, and again, not so easy, but the groups that are deemed to be most sympathetic, and to really raise the question of what kind of pattern would that really repeat, and who is left out. So thank you for this really welcome research. I guess I'm again want to remind folks to raise a question, but to start us off, I have one question that I'm going to pose to Zoe first, and that is, you've made some clear recommendations in terms of policy. Of course, it really seems like we're stalled right now in terms of all types of immigration, whether you want to call it reform or abolition of Trump era policy. So what do you think are the chances of anything passing for the midterm elections? And if so, where do you think the specific policy recommendations that you've just made with the Citizenship Act, what are the chances do you think that it has?
Yeah, that's a very challenging question, and I'll invite anyone to jump in with me, because the political analysis, I don't know if I have it all prepared. Yeah, I think it's going to be challenging. I appreciate your framing. I mean, I think the pandemic has made clear that immigrant workers are and always have been essential to our economy, and I think people could get behind the proposition to expand citizenship to essential frontline workers, but the general legalization program is going to be challenging, and it always comes accompanied with, measures to kind of buckle down on criminalization for other groups, right? Or we'll see it paired with increased militarization of the border. So it does raise some questions of what is the way forward without focusing on groups who are more sympathetically framed at the expense of others who continue to migrate and need to migrate to the US. So I don't think I have a perfect political analysis, but I don't know if Ryan or Jose have anything to offer.
Well, I can offer something, but not much more than Zoe did. Clearly, I think there's a low chance we're entering into an era of high inflation, which has captured everyone's interest, a war in Ukraine, which is precipitating a lot of refugees, which is also going to be an interest. It seems unlikely to me before the midterms that there'll be any substantial movement. But I do want to come back to the framing that Zoe left us with, and you picked up on, Erica. I mean, this is a really thorny issue. Do you go for the low-hanging fruit? Do you get what you can and establish a precedent, which creates complicated and, to my mind, some adverse consequences down the line? Or do you hold out, knowing that could mean that you get nothing? And as you point out, Erica, none of this is far from certain that there'll be any movement, right? And it's easy, and I want to acknowledge it's easy for us to be here talking about this in an intellectual capacity. It is clearly far more difficult and perilous for those who are experiencing this. And that's an important thing to acknowledge. But you put your finger on, I think, the question of the day, Erica.
I also wonder whether, as Zoe pointed us to, focusing on what workers are doing themselves, but also let me add in states. If the federal government is going to be so deadlocked on so many issues, we have already seen states, not essentially in a good way, but states like Texas acting on their own accord. And of course, we've seen it before, such as California and Proposition 187 in the 1990s. But is there movement among states not to enforce its own borders in the way that Texas is doing, but offering more protections to essential frontline workers in ways that the state can control? Of course, it can be limited, but should we be looking to states as well?
Yeah, I think absolutely. I mean, I'm thinking of like different insurance programs that are fully or partially state funded. And I believe California has done a lot of great work on that, of just using state resources to make health insurance more available to people across immigration statuses.
And I guess I would add, in addition to states, I think we're thinking of local governments as well. I mean, we've seen examples locally here in the Twin Cities of the city governments being really very consciously and transparently communicating that they are not concerned with immigration status when they provide resources that are helping people during the pandemic. And obviously a real clear difference from the Trump administration, and even a difference from the Biden administration.
Right. Thank you. Oh, sorry. No, go.
Yeah, no, I'd love to jump in real quick, and I guess I will speak only on my behalf, and this is because you brought up the Trump era policies, and we're bringing up Democrats, Republicans, and I think it's worth saying that neither one is the champion of the immigrant, and we have not seen that. We have not seen that during the Obama era. We haven't seen it during the Trump. I'm not saying I'm in any way in favor of anything that Trump did, but in no way is either party putting the immigrant and their needs up front. And if the essential frontline workers that we just showed here, 7 million of them, if that can't even be used to make the case to push that to the forefront, then I think it's just a reality that neither party really is having their best interest in mind, and we just have to call it for what it is. So I just want to call that part out.
Absolutely. And not to end on a depressing note, but to be honest, we've already seen how that moment of sympathy, when we were all having those signs on our lawns, we love our workers, our nurses, our teachers, we've seen how that moment seems to have passed. And so again, Jose, if we could not have made use that moment as some traction for some lasting policies, you know, what is the future really hold for us? So again, this is incredibly sobering. I want to close out by thanking you again. I want to share with attendees that this research pairs really nicely with what the IHRC has been doing during the entire pandemic, which is to document the disproportionate health, economic, and social impact of the pandemic on immigrants and refugees. And you can check that out by going to Immigrants in COVID America. We have 2 research reports that look at vaccine accessibility, another one on detention, on the detention industry. The first one produced by Isabella Rollins, the second one by Eunice Kim. And we also have a number of stories from the pandemic that we produced in partnership with the Sahan Journal and with journalist Ibrahim Hirsi. So to take us out, we're going to end with one of our digital stories featuring an essential frontline worker, Hani Jacobson. The title is "The Birth of a Hero Amidst the COVID Pandemic." Thank you, everyone, and enjoy this story.
Hi, my name is Hani Jacobson. I'm a community health nurse in St. Cloud, Minnesota. In 2005, my family and I arrived in St. Cloud. We became a part of a small Somali population here in the city. And before that, we lived in Atlanta, Georgia since early 90s. Shortly after my arrival, I started working as a medical interpreter. My job took me around the city to provide language services to Somali patients and clients at local hospitals, clinics, and government centers. It didn't take me long to notice some of the harsh treatments that many refugee and immigrant Somalis had to deal with here in central Minnesota. I often witnessed rudeness, racism, and Islamophobia in these spaces where I was interpreting. The lack of cultural awareness and competency perpetuated these harsh treatments. Doctors and nurses didn't take the time to talk to their patients about procedures and treatments. When dealing with people from communities that are facing health, cultural, and socioeconomic disparities, you have to take time and intentional focus to really get to know like every aspect of the person's life. As a family that had already been through the system and had so much help along the way, we felt responsible for our new refugee families. So I found myself not only interpreting what was being said, but also advocating for them. I did this at every setting where I was providing language services, whether it was a clinic or a hospital or a government center. This work really inspired me to pursue a career in healthcare, and that's why I became a registered nurse. In 2019, I took a new position in community health and wellness promotion at CentraCare. A few months into my job, the pandemic struck. As a result, I had to turn my attention to the pandemic. In partnership with other leaders, my team and I began to educate the community about the deadly impact of the virus, communicate with them about the importance of social distancing, and connect them to resources. With the unfolding of the recent vaccine rollout, I've shifted my priority to inform community about the importance of COVID-19 vaccination. We're also fighting misconceptions that many in the community have about the vaccine. They think the vaccine has pork products, fetal cells, causes infertility, or even illness and death. Of course, none of these claims have evidence to support them. So we're working to disprove them, these myths. While we're respectful of everybody's choice, whether they want the vaccine or not, our goal is to make sure that people are making informed decisions. So at the end of 2020, the Minnesota Council of Nonprofits and the McKnight Foundation recognized me for the work I've done around COVID-19. I was also a finalist for March of Dimes Nurse of the Year for the Diversity and Advocacy category. I was both humbled and in disbelief to be recognized. So many in healthcare are doing this work. It is a privilege that organizations in our communities are paying attention to our positive contributions. I do this work with other dedicated leaders and professionals in Central Minnesota. So I want to thank them all for their unrelenting commitment to serving our communities. Thank you so much.